There are two entry points to the pathway. Entry point A is for a person looking for information about ADHD online. We are proposing a consistent set of educational materials available across all relevant websites so that when someone Googles ADHD, there is something available to support them. If a person relates to the information, they can complete an online self-assessment as part of the repository, which will give them an indication of whether they meet the threshold for ADHD. Some people may have found the support that they needed via the educational content. Others that meet the threshold can select to generate an appointment with the mental health practitioner for further support. Entry point B is for a person that calls their GP reception. In the case that someone directly asks about potential ADHD, they can be directed online to complete the self-assessment. For those that have a more general mental health related concern, the GP receptionist would refer them to a mental health practitioner appointment. Other queries would go via the GP and be redirected to the mental health practitioner where appropriate. The mental health practitioner is a new role to the primary care team. Within the initial appointment, the mental health practitioner would build upon the online assessment and stratify the person based upon need. They would also set up all patients on the self-management platform. For those categorised as low need, they would be able to manage their condition entirely via this platform. The platform would include the same educational content as the repository, as well as trackers and other useful tools. The platform would also integrate with a variety of apps that can be prescribed based on the circumstances of the individual. If someone lives with anxiety, for example, they could have online CBT as part of their platform. A different person may need an app to support with their sleep. Many people should be able to find all of the support that they need via the platform over the course of their lifetime. However, there would be a self-escalation route available within the platform for if someone's circumstances change and they need to see the mental health practitioner again. Those categorised as medium need would have the platform, but may also need additional treatment options available in primary care. For example, prescribing of anti-anxiety medication. This is where the mental health practitioner would need to seek support from the GP to prescribe these medications. In some cases, a person may need an official diagnosis for other purposes, like work or university, in which case they would be referred to secondary care but as a low priority assessment. Where there is an ADHD specialist GP available in the primary care team, they could provide, for medium need patients, a diagnosis or even prescribe some ADHD medications. Those categorised as high need would be directly referred to secondary care as high priority. Any secondary care referrals would transfer with all patient and assessment information so that the secondary care assessment can be built upon existing info. Secondary care now receive a set of referrals that are prioritised and come with existing assessment data. For those that are low priority and simply need a diagnosis, once this has taken place, they can be passed back to primary care for management via the platform. High priority referrals also undergo a needs stratification as part of the initial assessment. Those that require medication only can be titrated, stabilised and passed back to primary care for their annual review. These patients would only come back to secondary care if medication alterations were identified as part of an annual review in future. This means the only patients retained in secondary care are those that need additional specialist support. This ability to step patients into primary care for their review will ensure there is always capacity and flow through the secondary care system.